shock. All types result in decreased tissue perfusion and acute circulatory failure. So you can find the concept map for this on page 978. There's a box on 979 that talks about the consequences, and 980 that talks about the different IV drips that are utilized for this. Hypovolemic shock is the most common type. This is due to loss of circulatory or intravascular volume. There is a box on page 981 for the different causes. Pathophysiology is in a figure on page 982. Symptoms, initially there are none. You can lose up to 30% of blood loss and still have no symptoms except maybe restlessness, a little bit of restlessness. Between 30 to 40%, you're going to have loss of 30 to 40% loss. You're going to have dysrhythmias, mixed acidosis, oliguria, azotemia. There'll be ashen, cold, clammy, and lethargic. And remember, azotemia is an elevation of your BUN and creatinine, and oliguria is less than 400 milliliters an hour out. If you lose greater than 40% loss, your patient will be cyanotic, mottled, in coma, hypotension, very tachycardic, with a very increased systemic vascular resistance. It will be a major, major problem. The first symptom, as I said, will be restlessness, change in your level of consciousness, but from then on, it starts to go downhill. Treatment, give them fluids. Treat the cause. Autotransfusion, if they're bleeding and you can give it back to them. Prevention is probably best. I know, daily weights. Now, modified Trendelenburg might be used, but remember, you do not want to increase intracranial pressure, so you have to be very careful with that. Nursing diagnoses for this are on page 983. Cardiogenic shock is due to decreased pumping ability of the heart, and there's a box on page 983 for the different causes. If you have 40% of your myocardium injured, with an acute MI, you probably will go into cardiogenic shock. Has a mortality rate of 50 to 60%. Now that's better because it had been 72 to 84%, so we're making progress. Pathophysiology figures on page 984, and the symptoms are in a box on page 984 also. But these are some of your compensatory symptoms: tachycardia, tachypnea, and alkalosis. You'll have crackles, a decrease in your level of consciousness, hypotension, and a decrease in cardiac output. Treatment for this is to increase the pumping action and the tissue perfusion by giving inotropic agents, vasodilators, vasopressors, antiarrhythmics, diuretics, intra-aortic balloon pump, bypass surgery or PTCA may be done, and a ventricular assist device. You'll find nursing diagnoses on page 985. Distributive shock is due to maldistribution of fluid, and there are three types. One type is septic shock. This is due to microorganisms, and there's a box that discusses this on page 991. 45% of your patients will die with this. Pathophys is on page 992. Symptoms are on page 994. Treatment is in a box on page 1020. The treatment's in a box on page 994 also. That 1029 is a mistake. You'll have cultures, fluids, the ventilator, nutrition, antibiotics as part of your treatment. Your diagnostic criteria are on page 993. Definitions between sepsis and septic shock are on page 991. Your precipitating factors are on page 992. Evidence-based practice for treatment of septic shock is on 997, and your nursing diagnoses on 996. Anaphylactic shock is another type of distributive shock. This is an antigen-antibody reaction or a hypersensitivity reaction. This is in a box on page 986. Patho is in a figure on page 987. Symptoms start within minutes, and they peak in 10 to 15 minutes. Remember, they do not, it does not occur with the first dose. It occurs with the second dose of anything, usually. And as I said, there's a box on page 988. Treatment, steroids, 1 to 2 milligrams per kilogram IV every 6 to 8 hours. Benadryl, 1 to 2 milligrams per kilogram, a max of 50 milligrams, IV Q4 to 8. Epinephrine, 0.1 milligram per kilo, IV push, and fluid replacement. You'll find information on latex allergies in a box on page 986 and clinical criteria in a box on page 988. Your nursing diagnoses are on page 989. Yes. And neurogenic shock is the final type of distributive shock. It causes, it's due to decreased sympathetic tone. It causes vasodilatation and, I take that back. It's due to a decrease in sympathetic tone. The symptoms will start in minutes and they'll last months. It's very rare. There's a figure on page 990 that shows the pathophys. Symptoms are hypotension, bradycardia, hypothermia, and a warm, dry skin. You don't want to use a heating blanket because the heating blanket will cause vasodilatation and will decrease the blood pressure further. Treatment are fluids, pulse oximeter, and possibly a ventilator. Nursing diagnoses are on page 990. And that finishes shock. Thank you.